Hey, good morning, everybody. We're going to give people about another 60 seconds or so here to get logged on, and then we'll go ahead and get started. All righty. Well, it's about that time. So, good morning, everybody. This is Tyler Finken, Health Marketing Director over at Western Marketing. Just want to say thanks, everybody, for taking the time out of your busy schedules to jump on this webinar with us this morning. Got a really, really great webinar lined up for you here. We're going to be going over the senior market products, specifically the MedSupp over at Allstate Health Solutions, and touch on a couple other things that they've got going over there as well. So, today we have Andy Larson, one of the VP of Sales over at Allstate Health Solutions with us. He's going to be leading this webinar. So Andy, certainly appreciate you taking time out of your schedule to be with us today as well.
Yeah, thanks, Tyler. Appreciate that. And thank you to everyone on the call. I can't express enough how awesome it is to work with Western Marketing. The Finken family are phenomenal people, and that carries on to the staff as well at Western Marketing. So thank you so much, Tyler, for having me on here today to spread the gospel of Allstate Health Solutions. My name is Andy Larson, Field Vice President, Regional Sales Director for Allstate Health. You might remember me from the National General days. Allstate acquired National General here over the last couple of years, and as of September, we rebranded to Allstate Health Solutions. So if you're familiar with National General, or maybe you're looking at who's Allstate Health Solutions, I know who Allstate is, but where they come from in terms of the health business, we came from the National General brand, and since we've rebranded to Allstate Health Solutions, it's been a pretty successful transition. So we're excited to bring it to you today. And with that, I mean, the Good Hands brand brings familiarity, right, and peace of mind, that comfort for the clients. It's a well-known brand. You can argue that it's one of the larger brands in the market for different reasons. But the familiarity of maybe the mayhem guy, or the confidence that you see behind the field goal nets during a college football game to kick that game-winning field goal, that just brings that image to the table for not only for you, but more importantly, your clients as well. If you've been working with National General, you guys did a great job of championing that brand, but the Allstate brand is going to take that element of explanation out of the way for your client. And as we continue on as Allstate Health Solutions, we are all things individual. We have something for any of your clients from 0 to 99. And no matter what type of agent you are, we have products and tech solutions to help get you there. Today, we're going to focus on the senior market, though, where we have created some innovation on the Medicare Supplement front, and then other products that we've developed along the way and more to come. But also, just as an aside, with your contract, you also do have access to our full portfolio of under 65 products, including short-term medical and a bevy of other supplemental products. And if you are interested in group products, contact Western Marketing. They have connections with our team at Allstate Benefits to connect you with group plans. But today we're here to talk about the senior market, some of the innovation that we've created in this space, specifically with our Medicare Supplement and the discount program. Maybe you've seen it, maybe you've seen us on CSG, but not quite sure what it all means. So today we're going to take away all that unknown and make sure that moving forward it's crystal clear what to look for, how to find it, but what does it really actually mean? So innovation, right? So Medicare Supplement is by and large a regulated product, for lack of better terms, commoditized. So they all look the same. Maybe there might be a value add that differentiates one over the others. So When you make that decision or your client makes that decision of who to choose for Medicare Supplement, it might come down to that trusted brand. With the Allstate brand, we've taken care of that and made that much more stronger of a proposition. Competitive rates. With our new innovation, we've designed our rates to be very competitive, not only for underwritten business, but at T65. Simplified process might be the reason why. It might be commissions, might be service. Any of these decisions that might lead to choose a Medicare supplement carrier, Allstate Health Solutions is going to check those boxes. And talking about the brand, not only with the Allstate Good Hands, but we also bring an A+ rating to the table. That's important for a lot of you. A strength of our parent company, Allstate, the $51 billion in annual revenue is significant, and the strength of the financial backing to bring that A+ rating. We talked about the innovation, up to 25% in stackable discounts, and there's discounts available on our dental as well. The instant decision e-application, 80% of our applications are issued on an instant issue basis. We'll get more into that. And then flexibility, you can write any day effective dates. I just spoke with an agent this morning that is looking for a next day effective date because they're within a time frame window for an anniversary rule case. So within the scope of Allstate Health Solutions, we're very flexible to work with, but we check a lot of those boxes. So let's stop burying the lead here. Let's get into the discounts, because that's really where we've innovated the most. When you think about Medicare Supplement and rates, you know, the idea is if you lower the rates for everybody, then the idea is, okay, well, if you have the lowest rate in the market by far, then we're going to have claim issues. Well, with the Medicare Supplement multi-discount program, we are looking at it from a different lens. We're not lowering the rates for everybody, but we're targeting a specific risk factor that long-term will keep our loss ratios in line and be able to keep our rates affordable for a foreseeable future. That's the idea. So how do the discounts work? The first discount related to discounts that already exist, and that's the roommate discount. Roommate discount is 7% offered to someone who's residing in the house, 50 years of older, for at least 1 year. Maybe some variations by state, consult the underwriting manual for that, but roommate discount continues. But where we've made the first addition to add up to 25% is that if the client has someone applying in the same residence at the same time, or that person in the residence already has Allstate Health for Medicare Supplement, there's a dual applicant discount of 10%. So you take that 7 and you add 3 to it. So when 2 people in the residence apply at the same time, it goes from 7 to 10%. Now, the idea here is apply. Let's just say you have husband and wife apply at the same time. Only one qualifies through medical underwriting. That 10% still continues on for that applicant that does get approved. We're not going to take anything away once they apply. So keep that in mind. There are some dual applicant discounts that do require both applicants to apply, both applicants to be approved. Ours is simply they apply. So that's continuing on the discount and enhancing what's already been on the plate for Allstate Health Solutions. But the discount that I'm finding here that is going to be the most significant for you and for your clients, and one of the first questions that you should be asking. It comes in the form of financial underwriting. So again, we're not lowering the rate for everybody, a form of financial writing, and that is if your client has the ability to pay annually, they're going to get a 10% discount right off the bat. Leads persistency factors that are favorable for the carrier, plus financial underwriting. Those that have the ability to pay in full typically take care of their finances. And the bet here is that they take care of themselves in other areas as well, such as managing their health. So if you were to, the first question that you ask your client is, do you have the ability to pay annually? We can get you 10% with Allstate Health. We should be looking at Allstate first and foremost. Now, the other discount here that can round out to apply up to 25% is the form of behavioral underwriting. And that is in the form of a activity tracker discount of 5%. So if your client has a Fitbit, an Apple Watch, a Garmin device, any device that can connect to the following 5 apps: Apple Health, Google Fitness, Garmin, Fitbit, or Under Armour, If any of those activity trackers can connect to those five app-based programs, your client can get a 5% discount. We're not tracking the minimum amount of steps. We're just tracking the steps to formulate data to help predict future outcomes. We're not going to be putting GPS on your client to see if they went to Culver's for 3 meals a day. That's not the intent. The intent here is to split the difference in terms of what we believe to be those that take care of themselves by monitoring the steps that they take will lead to healthier outcomes from a claims perspective. So with these discounts, they are part and parcel of each other. So maybe one client only has the activity tracker discount, they're going to get 5%. It might be 12, it could be 17, it could be 20, it could be 22. But if all discounts are exercised, they fit this client's profile, up to 25% in discounts can be realized on top of already competitive rates. And in addition, before we even get to the discounts, we've implemented rating classes that are going to attract or reward a healthier client as well. So therefore, we're trying to attract the risk that is going to make our pool, our block, the healthiest. Now, the qualifications for preferred rates are going to be non-tobacco and height and weight chart build. But if your client is part of that healthier class, they can qualify for our preferred select rating class. The one additional question is going to be, in the last 5 years, has medication been prescribed or recommended for depression? With regard to the height and weight chart, we do have a more enhanced criteria for build, but if you look at the build on the preferred select compared to the preferred, you could argue that someone who's 5'9", 200 is going to qualify for a preferred select rate, but on the BMI scale, they might be borderline obese. So it's pretty liberal in terms of the preferred select. When we rolled this out, we looked at our data and said approximately 70% of our clientele would qualify for preferred select based upon previous enrollments. We're running probably between 60 and 70, so we're within the margin of error of what we predicted, and so far everything is performing very well in terms of what we've expected with the concepts. So between the preferred select as your initial marker and then the discounts, how does that look and how does that impact rates? So when you factor in, first of all, before we get into rates, let's discuss where we have this available. The green states that you see here are going to be the states where the multi-discount program is available today. And in these states, we either already had a competitive rate or we have made adjustments to our rating structure to what we call new charter pricing. So our pricing is going to be within the top 5 in most of these markets anyway, if not the top rate. But then you add in the discounts, it's cherry on top. We've also added in a new charter for some of these states as well, such as Arizona, Colorado, Illinois, South Carolina, and Texas. There's no new contracting that's required of that new charter, but we're rolling out new charter pricing. Whether it's National Health Insurance paper or American Heritage, which is the new charter, it's all going to look the same from a brand and a product standpoint. So really, it's just a seamless endeavor when it comes to the product itself in those new charter states. The states that are in yellow or orange, depending on how you're looking at it, those states will be effective June 1st. So keep in mind that if you're looking at these states and saying, well, you're not in my state, those states are coming down the line. The states in blue are going to be roommate discount states only, just based upon a regulatory issue, a filing issue, or a business decision. In these blue states, though, we still offer competitive rates. New Jersey especially is a state that we're pretty excited about. That's very competitive. So as we continue to evolve with this, our full footprint minus those handful of states will have the multi-discounts and we'll have competitive pricing to boot. And with that, we look at some of these states here. The states that you see in blue will be reduced rates as well. So we have those states online today, but as we look at 6/1, we will have reduced pricing in these markets coming online. So getting back to the rates, how does this impact? As you see here, when you look at maybe just the stackable discounts, how they might go down the line. If we were to maybe focus on that plan G in the middle there, that preferred select rate, just a preferred select, no discounts, Plan G for a female age 65 to 72 in Des Moines, Iowa, $91.99. Already a competitive rate in the Iowa market. Now, as you go down the line and add the preferred select plus the roommate discount, now we're down to 85. Add in that 3% for the dual household discount, now we're down to 82. Add in that annual pay, totaling up for 20% discount. Now we've have an annual payment of $894.12, but that effective premium goes down to $74.51. And then you add in the activity tracker, which actually adds up to 25%. Your final rate on an annual basis for this client is $849.48. So we went from an original $91.99 for that rate, just a monthly pay, preferred select rating, down to an effective rate, if you divide that annual rate by 12, of $70.79. We're only factoring household discounts. We're factoring in the annual pay basis, that financial underwriting, and then we're factoring in the activity tracker, that behavioral underwriting. We've saved this client $21 per month over the course of the year, $252. And here's where it comes into the storytelling. Not only can you differentiate compared to other MedSupp carriers just from the discount program itself, but maybe these discounts offer other products and services to be sold by you or to be recommended by you to that client, whether it's a life insurance plan, an accident plan, or a cancer plan or hospital plan, whatever it might be. That $250 can be repurposed into other products and services you offer. Secondly, you can ask the question, Mr. or Miss Client, does that $252 annually, will that help you put more, help you with putting gas in the tank, or help you offset some of your bills, whatever it might be? That's going to be provide some nice relief for a client, especially in the world of inflation. And lastly, you can say, Mr. or Miss Client, we just saved you 25% on your premium by exercising these discounts. You've just hedged against your any future increases by 25% annually. So those are powerful stories that you can tell to differentiate compared to what other options might be in the market. Now, let's just say Allstate Health is maybe 4th or 5th on that CSG listing. These discounts might also get us up to the top. And again, those discounts are rooted in financial or behavioral underwriting. So the lead here, though, is if your client can pay annually, that should be the opener to the conversation to Allstate Health. And from there, you can tell other stories. In fact, we have some agents who have clients that have left the meeting, and the first place they were going to go was to Target to get a Fitbit, and that way they can get that 5%. And that actually just leads to more suggestive behaviors as well. If a client doesn't know they can get a discount by utilizing an activity tracker, maybe that's the catalyst for them to start using one and take more proactive measures of their health, and you've recommended that concept to them. So now the question becomes, what other value adds does your MedSupp provide? Okay, the discounts sound great. We're kind of scratching the surface on maybe some process that instant issue we'll talk about here in a minute. But what about the additional services or value adds that your plan might offer? Built in with each of our MedSupp policies is a hearing benefit through Amplifon. Now, the nice part about Amplifon is that they are manufacturer agnostic, so they're not going to steer your client into a specific device for their hearing services. They can choose any or most devices or manufacturers of hearing devices. Some great discounts on exams, so $75 hearing exam, but they are free if they do go to a Miracle Ear location. Some great warranties, 2 years of free batteries, 1 year of free follow-up care. So from that standpoint, some nice discounts through the Amplifon that's included. In addition, the Active and Fit is included as well, and that's the gym membership. Your client will have access to 10,000 fitness centers, including Anytime Fitness, YMCA, most YMCAs, LA Fitness, Snap Fitness, and those are nationwide type of gyms. Nice part is they're going to get a discounted rate. It's only $25 per month, and there's no long-term contract. So if you've ever tried to get out of a gym membership, you might find that there's going to be some early termination fees, or it's just a pain in the butt to get out of anyhow. they can change fitness centers at any time, no fees, no extra fees, just that $25 per month. And Anytime Fitness is about a $45 a month membership just for a single, so that's going to be a nice discount. So keep that in mind that these services are included, and your client will be notified post-enrollment of these services as well and how to utilize those. On our Medicare supplement, it would be remiss to say that we are not going through first quarter without a bonus. So we do have a first quarter bonus that applies to not only underwritten, but also T65, the open enrollment, and then anniversary and birthday rule. So the rule is that if you sell 5 policies each month, that's your entry point, and then we pay back down to policy 1, and there are no limits on top of those 5. So just sell 5 policies in any given month of the quarter. That gets you in the door. We'll pay you up to 50 policies if you write 50 policies. And the payout will be determined based upon open enrollment, 125, T65 will be 25, and then anniversary birthday rule would be 50. So not only do we have a innovative concept that is unique and fresh to the market, a strong brand name with Allstate Health Solutions that's going to be recognizable to your client, some nice value adds that are included, and a bonus to go with it. Hopefully we've gotten you excited to just on the Medicare Supp front. But as the ShamWow guy says, wait, there's more. We have more to the portfolio than just our Medicare supplement. As an organization, as Allstate Health Solutions, as we take on that Allstate brand, Allstate does have the intention of growing the senior market, and not just from a MedSupp perspective. We want to be known as a senior market carrier, and to do that, we have to expand our portfolio. And we've done that to an extent with our dental, vision, hearing, our senior indemnity product, but we've got more product coming soon. Before we talk about what's coming soon, I want to touch on our DVH plan. Now, our DVH plan we'll put up against any other dental plan in the market. It's a phenomenal product. It's eligible for ages 55 and up. The keywords here are there are no waiting periods. There's day 1 coverage for basic, major services, denture, and implants, depending on the plan design chosen. It's a PPO network, but it's through Aetna Dental Administrators, which is a national network. Approximately 90 to 100,000 providers are included. Out of network, simply just usual and customary rates apply. But we talk about day 1 benefits. The benefits will actually double up in year 2. With the dental plan, there is an optional vision rider, so the vision piece to that is optional, and that's through a Visas. Highly competitive on the access-wise through the retail side. So many private practices are included, but the retail side is going to be put up against any other vision network in the market. So just real quick on the dental side of things, I don't want to go through this line by line, but a couple point outs. If you look at, we have 3 different levels of coverage. If you look at the basic services, the last line there in that box, and you look over at level 3, you'll see that day 1 it starts 50%, but on year 2 and beyond, basic services are covered at 100%. So you can't get any better than that in the market on basic services. So on our level 3 plan, you'll have 100% coverage for preventive and for basic services starting year 2 and beyond. And then you get into more of the major services, dentures and implants. Levels 2 and 3 are going to be more on the denture and implant side. But we have a level of product that's going to suit any buyer. So if your client is just more concerned about their preventive services and want that covered, you can find a product for under $20 a month on that level 1. And then level 2 and level 3 provides a flexible product, not only for a level of buyer budget-wise, but a level of need as well. The DVH footprint is vast as well. We have a majority of our states that are covered with the multi-discount Medicare Supp are included within the footprint of DVH as well. And by the way, we have some great premium discounts that apply to the dental as well. So if your client chooses our dental, vision, hearing, and they have not had a filling, crown, root canal, denture, or implant in the last 12 months, that's a 10% preferred rate discount. In addition, if you are writing our Medicare supplement, you have the ability to bundle the DVH plan on the same application, check a box, and your client will be bundle billed as well. But by bundling the DVH with an Allstate Health MedSupp, your client gets a 10% discount just on the DVH just for bundling. Add these two discounts together, that's 20% discount on the DVH, and that's another story that you can tell, and you can cover not only the MedSupp but the dental in one fell swoop for your clients. Set it, forget it. They're going to get one bill. All is good in the world. And lastly, coming soon to expand our portfolio, we're coming out with a final expense option here, likely mid-summer. And with the final expense, we're going to have a preferred standard rate structure, level and graded options. We're going to be real flexible in terms of eligible ages. We may actually go into the 40s, to be determined on that front. But we talk about final expense, what is the process? A lot of times it's how easy is it to get issued. Within our e-application, you will have an instant issue feature to lean on to make the enrollment piece very, very convenient and get in and out of an application. We'll have available riders such as terminal illness and grandchild rider included, but then there's going to be the other add-ons such as active and fit, which you find in the MedSupp, but also Allstate Identity Protection is an added available rider as well. So kind of taking into account some of the other products and services that Allstate offers. We are going to have a 46-state footprint. I believe we are going to be launching 25 to start, or at least that was the intention. Our intention, folks, actually was to launch this back in September, but the rebrand kind of took over and all of our resources got sucked into that. So mid-June or June of 23 is our target launch. More to come on final expense, but we're excited to bring this product. We're getting good feedback from those that are heavy players in this space. They're excited for it. Rates have been shown to be competitive. Commissions have been shown to be competitive as well. So we'll tease you with that, but more to come here in the spring as we get closer to launch on final expense. And before we get into some of the the process things, I want to introduce Chris Neek. Chris Neek is part of our sales team. He is specific to the senior market, so subject matter expert on the senior market. But Chris is going to be a resource for you to help troubleshoot, to get onboarded if you need help getting familiar with your systems. If there's a question about of the policy or an underwriting question, you can always contact Chris. The QR code you see on his screen will connect you to his calendar. If you want to have a one-on-one with Chris just to get close to Allstate Health and develop that relationship back and forth, I encourage you to contact Chris here as the presentation wraps up and as the days go by and you want to learn more. So now we got some of the value adds. We got the additional portfolio. We got this innovative MedSupp. We got you all excited. How do we get started here? Now, what are we looking at? Now, many of you have already seen our rates in CSG. CSG is our best marketer, to be honest with you, but CSG can also be confusing as well. And I can guarantee that we've lost agents because just the way CSG displays things. It's not our fault. It's not CSG's fault. It's just the way that their platform is designed and wired. We had to design it or put it in as best as we could. So you'll see multiple options in CSG. But once we kind of show you CSG, some tricks there, how do you get writing business with Allstate? Because once you see things in CSG, you might as well just go to Allstate Health Solutions site and write it, and that's gonna walk you right down the path of what you need to know. But quoting in CSG, the first step is you're going to click on that run the quote. It's going to show you where to find the discounts. But the first piece you want to do is click on that household discount applied section, and then click that get quote. Now, where you want to go here, once you start seeing the quotes, you'll see either National Health Insurance, parentheses Allstate, or you'll see American Heritage, parentheses Allstate, or you'll see Allstate Health Solutions. The first thing you want to do though is open up or expand the result, and that's going to bring you to a section that you see where it's expanded below, where underneath the rating class it'll either say preferred select. It'll tell you if the wearable is applied or if the dual household or roommate discount is applied. So look under that rating class, and that will give you the rate that is going, or give you the discounts that it's going to apply. Ideally, I'd like to see it say 15% discount or 20% discount, but CSG is not wired to accommodate that today. And to apply on the annual rate, there is a taskbar on the left-hand side. Make sure that you check the box annual rate. And if you see Allstate maybe in that 5th position on these rates in terms of the standard discounts or the monthly pay, you're going to find that these Allstate options are going to filter straight up to the top, and you're going to have a perfect story to tell on that annual rate for your client. Now, once you've seen the rate in CSG, we recommend that you get to Allstate Health Solutions to run the quote and do the enrollment there because of the following reasons. We'll talk about that in a second, but if you're saying, well, I'm not even set up with Allstate Health Solutions, how do I do that? First off, get with Western Marketing, get your contracting done. They're going to send you a link to get contracted. Once you complete that link, you're going to be contracted within 24 hours. So if you finish the contracting link today, tomorrow morning, you're going to get a welcome letter that's going to look like what you see on the screen here. It's going to provide you your agent number. It's going to provide you your confirmation, but it's also going to provide you the next steps. And the first step is to register your agent back office. It's going to provide you an opportunity to create a username and password, but the agent back office is your hub for all things Allstate Health Solutions. Individual under 65 quoting, senior market quoting. But in the back office, you'll find a dashboard that has all sorts of guides in terms of agent guide for senior and under 65, product availability, additional underwriting features, or just user guides to help serve your clients in a much more convenient fashion. Access to all of our marketing materials as well. You'll also get alerts that will tell you if a client is past due on a policy. If you click that See All, that will pull up a report, which you can export into any other sort of CRMs or call lists that you guys utilize to keep organized with your daily activities. You'll also be able to see all your policies that have been written under the Policies tab, or you can do a search by client. But to get to the senior market quoting, you click on the Quote Senior button, and that will bring you to a platform that we affectionately call EnrollNat Gen. Now, we called it EnrollNat Gen underneath National General, but we haven't figured out a new name for it yet, so it's still called EnrollNat Gen. So if you hear ENG or EnrollNat Gen, that will apply to our quoting platform with Allstate. Now, the nice part about coming here, and this speaks to why you might write MedSupp, and that's process. Built into this platform, we have the intelligence and logic of our underwriting manual to be able to ask the questions in a certain manner where you will get instant decisions on 80% of your cases, approximately 80%. And the other 20%, you can expect a decision within 24 to 72 hours, just dependent upon volume. But outside of an enrollment period or a busy season, you can expect more that 24 to 48 hours. So that's a huge differentiator in terms of being able to know that, hey, I can get this done within a day or two if it's not an instant decision, especially if you have a need for that next day effective date. And when you do get that instant decision, that policy in your back office is going to load within the hour, and you can get an what we call Insta ID card, which will allow you to download or send to your client a temporary ID card while they await their ID cards to come in the mail. So you can provide that peace of mind for your client and that confirmation within the hour on an instant decision. Now, also too, within the platform, you'll be able to see the applications that you've written, download the ID cards from there as well. So also you'll find contact information for policyholder services, for for paper application instructions, what have you, and then also forms, brochures, guides, agent guides, underwriting manuals, etc., are all housed within this platform. Again, we touched on the multi-product enrollment with the DBH, but then when you come to simplicity of the signature, common question is, what are your signature options? We have 3 convenient options. One is going to be e-signature, similar to a DocuSign type process. The other is going to be voice signature. So you say, hey, Andy, you know what? My client doesn't have an email address. They're not going to be able to do this e-signature. You can simply call the 800 number with your client on the line. There's be a 4-digit PIN assigned to that application, and then they'll go through a series of prompts. Takes about 4 to 6 minutes. Policy is signed. But lastly, we have a security question feature, which will allow you to set up a security question for your client, such as mother's maiden name, What's your favorite color? What street did you grow up as a child? One of those type of questions. It does require the client to have an email address to send documents and disclosures, but at the end of the day, once they establish that security question, then the policy is signed. They don't have to do anything besides receive that email with those disclosures, no action on their end. So that's going to speak to the process of not only the instant decision, but the security question feature. That's going to make the process and the experience for the client and for you being able to move on to the next client in a more efficient manner, a story that you can tell and feel comfortable about as you work with Allstate Health Solutions. But in the platform, you'll be able to do under the quote section, you'll do a quick quote and enroll. You won't have to enter any names, demographic, or names or emails or addresses. Simply add in the zip code, date of birth, and the gender, effective date. Click quote now, and then it'll bring you to all the different products that are available on the left-hand side. It'll have the ability to choose your product on that front. So if you're only writing dental only, you can just simply click to the dental piece from that standpoint. But once you're in here, you're going to select your enrollment type. It's going to be underwritten, open enrollment, which is T65 or one of the guarantee issue rules. If you're in Missouri, Oregon, any of the anniversary or birthday rule states, it's going to have that anniversary rule button. And if you select that, that will only ask the required questions of that anniversary or birthday rule. Of course, macro question, height and weight, tobacco answer, and if the tobacco is answered never, and then the height and weight falls within line, it's going to pop up that depression question, and that's going to be the precursor for preferred select rates. If you check no, preferred select rates are going to populate, and then from there, you'll see that at the bottom it says calculate discount. So you get that preferred select rate. In this case, we're looking at a plan G. You click the calculate discount. It's going to pop up a box that's going to have you ask the questions. Roommate discount. Is that spouse applying for National General, or in this case, Allstate Health, Medicare Supplement? If you answer yes, but you'll see on the side there, it's going to tell you what those discount percentages are. So if you're with your client and want to show the screen, then they'll see that those discounts are applying. Activity tracker, and then they'll drop down for billing frequency. Once you select annual, then it's going to populate the annual pay. So just as in this case here, $111 for a plan G preferred select rate, monthly pay. When we come back, now it's going to say once that quote is run, $1,064 for that plan G. So once those rates have been applied, so we went from 111 monthly to 1,064. 111 goes down to $88 per month, and what you will see here, and what it doesn't show on the screen, it will tell you what that effective premium is on a monthly basis. So it tells a powerful story. Yes, it's $1,064 annually, but the effective rate if you divide it by 12 is only going to be $88. So if you're in front of your client, they'll be able to see that and get the receipts, and they'll know exactly what they're saving, and the system will tell you that story. Click it to add to the cart. Then you'll start we'll give you the option to add the dental plan, but then you go through the process. If you answer a question a certain way, it will tell you on the spot if the client doesn't qualify. So therefore, you won't have to write down names, phone numbers, social security numbers, Medicare numbers. You won't have to gather any of that. The application piece will go through it first. Then you get down to the security question here that's highlighted. That's the signature option. That's the final piece. And then once you have written the policy, it will show up under the application section. You can utilize that drop down there that'll tell you quotes that have been created, pending signatures, completed applications. All the different status dispositions will be available in this section under applications. And then once the policy has been issued, your client will be able to set up their own member portal at myallstatehealthsolutions.com. This is very important, especially if they have an activity tracker. The activity tracker is connected through the My Allstate Health Solutions portal. There are guides on how to do that. So if you need to assist your client, you can find that guide within the scope of ENG, Enroll Nat Gen, or on the dashboard of your back office. But your client can also download temporary ID cards here. They can check their payment statuses, payment methods, view policy documents, but again, to connect the activity tracker. Rule of thumb is that your client has 30 days to connect. Within that, to keep that discount. The discount can be applied at any time throughout the year by simply connecting through the back office with that tracker, or through the member portal with that tracker. Once that's connected, that will process through. They'll receive notification that it's connected, and then that discount will be applied. At renewal, if your client does a annual pay, or if there's business on the books, or excuse me, does monthly pay, whether it's new business or business that's already on the books, your client will have the opportunity at renewal to also process that annual pay as well. So therefore, at renewal, you can say, well, your rate, we had a rate increase maybe of 7%, but Mr. Miss Client, if you have the ability to pay annually, we can reduce that by 10%. So we're hedging against that future increase by allowing you to, or hedging against this increase and actually coming out a little bit better by implementing that 10% discount. So many stories you can tell, whether it's at the time of application or renewal, making Allstate Health the carrier for your Medicare supplement in 2023. Now, as we wrap, additional resources, when you go to your back office and you click on the marketing materials, that's going to bring you to allstatehealth.com. It's going to have both under and over 65 marketing materials, brochures, customer flyers, paper applications for a Medicare supplement. Just another space for you. It's a public site as well. Also allows you to, if you're writing a product that requires networks such as our DVH, you can connect to our dentist find or doc find through allstatehealth.com, as also through the quoting portals as well. Our YouTube channel is also available for you today. You know, we kind of scratched the surface on some products, but maybe you're thinking, you're saying, well, you know, Andy, I'd like to know more about your short-term medical. You know, I had trailing spouses of my clients that turned 65 that aren't quite there yet. That might be a good product for them. You can go to our YouTube channel at Allstate Health Solutions Sales, and you can go through anywhere from a 5 to a 15-minute video on any of our products, do a deeper dive, and then also there may be some demos on quoting as well that are in there. We're still updating this library as we've moved from NatGen to Allstate, just rebranding it all. And really the products are all the same. It's just we're putting it under the Allstate brand and kind of cleaning up the site. So not everything is in there yet, but as we continue to evolve, we will continue to add pieces to this. Now, last thing before I turn it over to Tyler here, and if they go over any questions, we do have for 2023 an agent incentive, and we're copycatting the folks at Western Marketing, and we are going to be taking our top agents in February of next year or March. We're still locking down the dates to Cabo. So we would love to have you join us there. So if you are qualifying for the Western Marketing trip, back-to-back incentives here for you. And this is a top producer conference, so we are taking our top 50 agents who produce $600,000 or more in Allstate Health Solutions premium. The nice part about this is if you write Medicare Supplement, DVH, or any of our under 65 supplements, $1 of premium is going to count as $2 toward the qualification. So let's say you write $500,000 in Medicare Supplement. That's actually going to qualify as $1 million toward the contest. So the more Medicare Supplement you write with us, the better your odds are going to be qualifying for the Cabo trip. The good news is that this contest already started. This started as of 12/15/22 for any policies effective then, because we wanted to take into account the enrollment period, the end of the enrollment period for under 65. Also, under 65 products apply to this as well. And we're going to extend this contest through January 15th of 2023, excuse me, 2024. First of the year, it's almost like writing the new year on a check. So we go through January 15th of 2024 to get through another under 65 enrollment period, another AEP. So therefore, any sales between now and then are going to qualify for the Cabo trip. Medicare Supp is going to be a huge driver toward that. So keep that in mind as you go through the year. Especially if you're in a cold weather state, February or March in Cabo is going to sound very, very, very nice. I'm in Minneapolis. It's -15 wind chill right now, and I could go for a beach and a margarita at this time. So hopefully you can join us. I'd love to see you there. With that, I'm going to turn it back to Tyler and introduce our team as well while I do that. We're here to support you and be an extension of Western Marketing. So however we can help get these concepts into your hands, make it simple for you, that's our goal. And we look forward to working with you beyond today and in 2023. So Tyler, back to you.
All right. Thank you so much, Andy. I certainly appreciate that, buddy. All I can say about that webinar is, wow, you pretty much have the trifecta going for you right now. Allstate has amazing rates in most of their states that they're available in. They've got an incredible discount and ease of doing business with them. And that incentive program to Cabo, man, that's pretty amazing. So hope everybody got excited about that. If you have any questions or if you need to get contracted or anything with Allstate, all you got to do is reach out to me or your marketer over here, and we'll go ahead and get that set up. Now, Andy, if you have just a couple more minutes, it does look like we had some questions come in during the webinar, so I want to try to run through those as quickly as possible. Do you still got a couple minutes for that?
Yep, absolutely. We'll do our best to answer, and if we don't have the answer, we will be sure to follow up with you, Tyler, to distribute those.
Yep, absolutely. So first question says that 10% discount, is that for each applicant?
If it's on the dual household discount, yes, it's for each applicant. Now, the only scenario where it would not apply, let's just say that spouse one turns 65 in January, and they have the roommate discount of 7%. The next spouse doesn't turn 65 until August. When that spouse turns 65 in August, they will be eligible for the dual household of 10%. But the first spouse that turned 65 in January would only be eligible for the 7, because at the time we don't have the dual applicants. Now, if let's just say both spouses apply at the same time because it's underwritten business, then both will get the 10%. And again, it's apply. Let's just say only one of the spouses qualifies through medical underwriting, that 10% still carries on for the other applicant that does qualify.
Okay, thank you for clarifying that, Andy. That was actually going to be my follow-up question to you on that one. So looks like the next question should have been answered by that response. Someone says, I recently wrote a client for a 1/1/23 effective date. Are these discounts applicable? Well, that would have had to have been determined on the application at time of submission, correct, Andy?
Yeah, that's correct. Like I said, if there's a activity tracker peak component, that can be added at any time. The annual pay discount can be applied at renewal. So keep that in mind as you go along the line. But the dual household, that's all at the time of enrollment.
Okay. Next question says, are these discounts combined? For example, if dual and then paying annually. So yes, the short answer to that is these discounts are designed to be combined. You can get that 7%, what they call roommate discount, or the 10% if you have 2 policies in the household, and you can combine those with the 10% annual discount if they pay annually, and the 5%, what do you call that one? I'm drawing a blank, Andy.
Activity tracker. Yeah.
Yes, activity tracker.
Yeah, the discounts are mutually exclusive, part and parcel of each other, however you want to call it. But the idea here is that if all put together adds up to 25%, and that's the story, right? But we all know that it's not going to apply for everyone. Not everybody is as technologically inclined to do to utilize a Fitbit or something to that effect. So the discounts can range anywhere from 5% for specific clients, or it can go up to 17%, just dependent upon that client's situation. Certainly can be, the key word, I guess, is up to 25%.
Correct. Next question says, if they don't qualify for the preferred discount, can you also get the other discounts like annual pay and household discount? Yes, you can.
Yep, absolutely. Yep, the preferred select is just a rating class. So, based upon those healthier criteria, reward the most healthy. But certainly, if your client is just a standard, a regular preferred rate, a preferred rate only, or even a standard rate, those discounts can still apply.
Okay. Next question refers to some information on CSG. Ben, if you're still on, I'll try to address that with you on an individual basis. The question after that is some underwriting questions. So Sharon, if you're here, I'll address that with you on an individual basis as well. If a client has a roommate already on the Allstate plan, does the dual household discount apply? That was answered earlier. Give me a second here. So the next question says, I am unclear the discount given to a new member within the 30-day period for signing up online. Please advise.
Yep, so that pertains to the activity tracker. So if the client enrolls with the activity tracker discount, we will issue the policy with the discount, but they have 30 days to connect. If they don't connect, then that discount would be removed. But again, the discount can be applied at any time throughout the year. So it's simply you have to have the My Allstate Health Solutions portal created by the client, and they can go in there, log in, and then add that activity tracker. And by connecting to the web-based or the app-based approved vendor. Again, there are instructions on your back office dashboard, as well as inside the forms and brochures and guides section of ENG to help you navigate that with your client. There'll be instructions within that as well. Your client will be sent instructions also.
Okay. Next question asks if this presentation will be sent out to you. Yes, this is being recorded. So Andy, with your permission, I would like to send the recording to all the attendees today.
Absolutely. And I'll add to that.
Next question.
Chad, if I could add to that too, if there is any interest in your agency, if you have sub-agents with you that want to do an office training, you know, if it's okay with Tyler, we'd be more than happy to help you out with that as well via Zoom call or locally if we're in the area. And then also Chris can provide some, you know, additional one-on-one to help reinforce what you've seen today or what you'll go back to on the viewing.
Okay. I want to be cognizant of everybody's time here, so I got time for about 2 more questions, and then any that did not get answered, like I said, I'll try to follow up with you on an individual basis. Next question says, if I have been appointed with National General, am I appointed with Allstate?
Great question. So with the rebrand to Allstate, it's simply a rebrand. It doesn't change any contracts. It doesn't change any paper. It doesn't change any products or filings. It's simply we are now part of the Allstate family. Even with any new charter states with the MedSupp product, there's no new contracting required. Our goal is to make either the rebrand or any new charters as seamless as possible, and as almost like it didn't happen. So that from that standpoint, really what you're seeing with the rebrand from NatGen to Allstate is a simple change of logos and colors, and you know, the power of the brand to go behind it.
Okay, and then last question here, Andy, and then we'll wrap up here. They asked, can Allstate EFT the annual premium, or does the client need to write a check?
Oh, you can do electronic, absolutely.
Electronic for annual premiums as well. So that sounds good. Everybody else, I know there's a couple questions still outstanding. We'll reach out to you shortly here to get those answered. But like I said, thank you for taking time out of your day to jump on here. Hope it was definitely beneficial for you. Let's go ahead and get everybody here contracted if you don't have one already. I will be sending out an email shortly here with the recording as well as some information, and then your marketer will be reaching out to you as well. So thanks again, Andy. Appreciate you, buddy. Thought that was a wonderful webinar, and you know, we'll get everybody up and running with Allstate here.
Thanks, Tyler. Appreciate everyone that jumped on, and look forward to working with you.
All right, everybody have a great Thursday.